Hello everyone, and welcome to our virtual educational program. In this module, we will be discussing self-management skills. Self-management is now a common term used in health education and is the name attached to many health promotion and patient educational programs. Self-management has been shown to be helpful for both the individual with a chronic, long-term condition, as well as for their caregiver or family member. In fact, research demonstrates that self-management skills are especially important for caregivers of individuals with conditions that contribute to behavioral and psychological concerns, such as depression, anxiety, or agitation. Managing an individual with such symptoms contributes to the stress that many caregivers experience in their role. However, self-management strategies that allow caregivers to manage their own stress and keep up with the care of their loved one are found to be beneficial. But what is the meaning of self-management? Everyone is responsible for day-to-day management of their health and well-being, whether they are living with a long-term condition or caring for someone else. Whether one decides to engage in a healthful behavior or not to be active in managing their condition, their decision reflects a management style, even though it may not be a healthful management style. In fact, one cannot not manage. The question is how one manages. Individuals are responsible for their day-to-day care over their lives, and self-management is a lifetime task. In this presentation, we will be discussing 5 self-management skills. The core self-management skills are problem-solving, decision-making, resource utilization, forming a patient and healthcare provider partnership, and action planning. Problem-solving is an important skill defined as identifying the problem, thinking of strategies to solve the problem, and carrying out the strategies. Problem-solving skills can increase an individual's ability to manage or cope with stressful situations. It helps minimize emotional distress even in situations that cannot be changed for the better. For more information on problem-solving skills, please view our video on this topic. Decision-making skills are part of problem-solving skills, and, in addition, individuals with chronic conditions and their caregivers must make day-to-day decisions in response to the situation. For example, how do I know whether this symptom is medically serious? Or, should I continue taking my medications when I have a fever? Decision-making is based on not having enough and appropriate information. For example, patients who survived a stroke and their caregivers can be taught to identify the serious symptoms or red flags that require medical attention, such as sudden numbness or weakness in the face, arm, or leg, or sudden confusion, trouble speaking, or difficulty understanding speech. The third skill of self-management is resource utilization, which is a skill to help you to plan how to find and utilize your resources more effectively. Many educational programs tell participants about resources, but do not teach them how to reach out to them or how to have a higher likelihood of benefiting from them. For best results, it is important to contact several potential resources at one time, as if casting a net for information. The fourth skill is helping people form partnerships with their healthcare providers. When dealing with a long-term condition, the role of the healthcare provider becomes that of a teacher or partner, as well as that of professional supervisor. The individual must be comfortable with this partnership, such that they can accurately report their symptoms, make informed choices about treatments, and discuss them with their provider. The fifth and last skill is taking action, which involves making a short-term plan and carrying it out. In fact, an action plan involves a period of 1 or 2 weeks and is very behavior-specific. The action plan should involve a goal that is realistic and that the person is confident in its accomplishment. Confidence can be measured on a scale from 0, totally unconfident, to 10, totally confident. If the answer is 7 or higher, then there is a good chance that the action plan will be accomplished. If the answer is less than 7, then this would be a good time to do some problem solving to make the plan more realistic. For example, Tracy wrote the following goal for herself.
This week I will walk around the block 3 times while my loved one is in the NeuroFit class.
However, she stated that her confidence is a 5 because she thinks going around the block 3 times will make her excessively tired, and also because she likes to use that time to run errands. As such, she changed her goal.
This week I will walk around the block once while my loved one is in the NeuroFit class.
With this new goal, Tracy rates her confidence at an 8. In conclusion, everyone engages in self-management as everyone is responsible for the day-to-day management of their health and well-being, or that of their loved one. Effective self-management includes the utilization of 5 skills, including problem-solving, decision-making, resource utilization, forming a comfortable partnership with the healthcare provider, and taking action by setting goals and accomplishing them. Thank you for your attention during this presentation. We hope the information provided was helpful to you.